We are told our entire lives that sleep is the ultimate healer, the time when our body repairs itself from the inside out. But what if I told you that for your eyes, sleep has become the enemy? There is a silent epidemic happening in bedrooms across America where healthy habits like using a ceiling fan or sleeping on your side are actively accelerating the aging of your eyes, turning your morning routine into a blurry, painful struggle. If you think waking up with grit in your eyes is just part of getting older, you are about to discover the science that proves otherwise. It is a startling thought, isn't it? We spend a third of our lives asleep, believing it's the time our body heals and repairs. And it should be, but for many of us, especially as we enter our golden years, the bedroom environment has inadvertently turned into a hidden culprit for our eyes. We are going to explore a hidden epidemic that affects millions of seniors, nocturnal eye stress. We are going to look at why your healthy 8 hours might be the reason your eyes feel 20 years older than they are. But here is the good news, and I promise you there is plenty of it. You don't need expensive surgery or another prescription to fix this. Today, we are going to walk through science backed practical adjustments to your nighttime routine that can restore moisture, sharpen your morning vision, and protect your long term eye health. We are going to turn your sleep back into the healing sanctuary it was meant to be. Before we dive into these eye opening truths, pun intended, I have a small favor to ask. If you are someone who believes that your health is your greatest asset, consider subscribing to our channel. We are building a community here dedicated to the kind of senior health tips that even busy doctors often overlook in brief appointments. And I am curious, where are you tuning in from today? Let me know in the comments below. It is always wonderful to see how far our community reaches. Let's begin our journey to better vision with something that seems universally accepted as a good sleep habit, keeping the room cool and circulating air. We have all heard that a cool room promotes better deep sleep. So you might turn on the ceiling fan or place a box fan on the dresser. It feels wonderful on your skin, doesn't it? But let's look at what that breeze is doing to your eyes. When you sleep, your eyelids do not form an airtight seal. In fact, for many seniors, the seal is slightly imperfect due to natural changes in skin elasticity. Now, imagine a gentle, constant stream of air hitting a damp sponge for 8 hours. What happens? It turns into a hard, dry brick. That is exactly what is happening to your cornea. A study published in the journal Cornea found that increased airflow velocity significantly accelerates the evaporation of the tear film, specifically the lipid layer that prevents moisture loss. When that lipid layer is disrupted by your ceiling fan, the tears underneath evaporate rapidly. You wake up with what we call evaporative dry eye. It feels like grit because essentially your eye has lost its protective lubrication, causing friction every time you blink. Shutterstock. The solution isn't to sleep in a sweatbox, of course. We want you comfortable, but we need to redirect that airflow. If you use a ceiling fan, try setting it to the lowest setting or reversing the direction so it pulls air up rather than pushing it down. If you use a standing fan, point it away from your face, aim it at your torso, or simply towards the wall to keep the air moving without creating a wind tunnel across your eyes. It is a small shift, but your tear film will thank you the moment you wake up. Moving right along, let's talk about something we do for about 7 to 8 hours straight, laying your head on the pillow. Now, you might be a side sleeper. It's often recommended for back pain or reducing snoring, which are valid concerns. However, we have to look at the mechanical pressure this puts on your eye. When you sleep on your side, you are often smashing one side of your face into the pillow. This does two things. First, it can distort the eyelid, potentially leading to a condition known as floppy eyelid syndrome, where the eyelid becomes lax and easily everts, or flips inside out during sleep, exposing the eye to the air and bedding. But more concerningly, there is the issue of intraocular pressure, or IOP. We often worry about blood pressure, but eye pressure is just as critical, particularly regarding glaucoma risk. A fascinating study conducted by researchers at the University of California, San Diego, and published in the journal Glaucoma suggested that sleeping with the head pressed into a pillow can significantly increase IOP in the downward facing eye. Imagine squeezing a water balloon. The pressure inside spikes. That is essentially what is happening to your eyeball. Over years, this nightly pressure spike can contribute to optic nerve stress. I want you to picture your eye like a delicate camera lens. You wouldn't store a camera lens by piling heavy books on top of it every night, would you? Yet, that is what side sleeping can do if the pillow is too firm or not positioned correctly. So, what is the fix? You don't necessarily have to force yourself to become a back sleeper if it causes you back pain. We have to balance our battles. However, consider investing in a contoured pillow designed to keep pressure off the eye area, often called a pressure relief pillow. These have hollowed out spaces so the weight of your head rests on your forehead and jaw, leaving the eye area floating freely. It effectively bridges the gap, protecting that delicate camera lens while allowing you to stay in your preferred position. While we are discussing pillows, we have to address what is living inside them. I know this isn't the most pleasant topic, but it is necessary. You wash your sheets, sure, but what about the allergens accumulating in the pillow itself? Dust mites are microscopic creatures that thrive in warm, humid environments like a pillow used for 8 hours a night. You might think, I'm not allergic to dust, I don't sneeze, but the eyes react differently. Dust mite waste is a major trigger for inflammation of the eyelids, a condition called blepharitis. This inflammation clogs the tiny oil glands at the base of your eyelashes. When those glands clog, you lose the oil that keeps your tears from evaporating. According to the American College of Allergy, Asthma, and Immunology, dust mites are the most common cause of allergy-induced inflammation in the home. Think of it this way: sleeping on an old, unprotected pillow is like sleeping with your face buried in a microscopic ragweed field. The inflammation is silent, but the result is red, swollen, crusty eyes in the morning. The actionable takeaway here is simpler than you think. First, wash your pillowcases in hot water at least 130 degrees Fahrenheit weekly to kill mites. But more importantly, buy a high quality, zippered, allergen proof pillow protector. It goes under your pillowcase and acts as a shield, locking mites out of the pillow and preventing anything inside from getting to you. It is one of the cheapest, most effective investments you can make for your eye health. Now, let's step back from the bed for a moment and look at what you are doing in the hour before you sleep. We live in a digital age. Maybe you love reading the news on your tablet, checking Facebook on your phone, or watching a bit of TV to wind down. It feels relaxing, but physiologically, it is signaling your body to stay awake and drying out your eyes. You have likely heard of blue light, but let's look at the specific mechanism regarding blink rate. When we look at digital screens, our blink rate drops dramatically. Normally, you blink about 15 to 20 times a minute. When looking at a screen, that number can drop to 5 or 7 times. This is based on research widely cited by the American Academy of Ophthalmology. When you stop blinking, you stop refreshing the tear film. You are essentially staring your eyes dry right before you close them for 8 hours. Furthermore, the blue light suppresses melatonin. A study from Harvard Medical School highlighted that blue light has a dark side. It shifts your circadian rhythm by twice as much as other light wavelengths. This means your sleep quality is poor, and your eyes, which need that deep sleep to repair cellular damage, don't get the downtime they need. Imagine running a marathon without stretching first. That is what you are doing to your eyes when you stare at a screen and then immediately try to sleep. The muscles are tense, the surface is dry, and the repair mechanisms are delayed. The fix? I challenge you to a digital sunset. 1 hour before bed, turn off the screens, switch to an audiobook, a physical book with warm non-LED lighting, or listening to soothing music. If you absolutely must use a device, use the night shift mode or wear blue light blocking glasses, but understand that the reduced blink rate is still an issue. If you can make that 1 hour screen free, you are giving your eyes a crucial buffer zone to rehydrate and relax before the lights go out. Speaking of hydration, let's talk about water. Many seniors purposefully stop drinking water in the evening to avoid those annoying trips to the bathroom in the middle of the night. I completely understand that logic. Broken sleep is frustrating. However, systemic dehydration leads directly to ocular dehydration. Your tears are fluid. If your body is dehydrated, it prioritizes the vital organs, heart, brain, lungs, and deprioritizes things like tear production. A study published in the journal Clinical and Experimental Ophthalmology found a direct correlation between higher plasma osmolality and dry marker of dehydration and dry eye disease. If you go to bed slightly dehydrated and then breathe out moisture all night for 8 hours, you wake up in a deficit. You can think of your body like a reservoir. If the water level drops too low, the shallow creeks, your tear ducts dry up first. So, how do we balance the need for sleep with the need for hydration? The trick is front loading your hydration. Drink plenty of water throughout the morning and afternoon. Then, with dinner, have a glass. In the hour before bed, take only small sips to wet your mouth. But here is the secret weapon: use a humidifier. If you can't drink the water, breathe it. In the winter, especially, heating systems strip moisture from the air, dropping humidity to desert levels, often below 20%. Ideally, your bedroom should be at about 45% humidity. By running a humidifier, you prevent the air from stealing moisture from your eyes. It acts as a passive hydration system that doesn't require a trip to the bathroom at 3 a.m. If you are enjoying these insights so far and finding them helpful, please take a second to hit that thumbs up button. It really helps us get this information to other seniors who might be struggling with the same gritty eyes every morning. Now, let's navigate to a topic that is a bit more sensitive, but incredibly common: sleep apnea and the masks used to treat it. If you use a CPAP machine, you are doing a wonderful thing for your heart and brain. But if that mask isn't fitting perfectly, it could be blasting air directly into your eyes all night long. We call this mask leak. Even a tiny stream of air escaping from the bridge of the nose acts exactly like that ceiling fan we talked about earlier, but much more intense because it is concentrated. Furthermore, there is the issue of the mask pressing on the cheeks. If the strap is too tight, it can impede lymphatic drainage around the eyes, leading to those puffy bags we all hate. But worse, significant pressure on the eye itself can raise that intraocular pressure we discussed. Research in the Journal of Clinical Sleep Medicine has noted that eye complications are a frequent yet underreported side effect of CPAP therapy. It's a double-edged sword. You need the oxygen for your optic nerve health, since sleep apnea starves the eye of oxygen, but the delivery system can irritate the eye's surface. If you are a CPAP user, do not stop using it. Instead, become a detective, check the fit of your mask every night. If you feel air escaping near your eyes, you need to adjust the straps or perhaps try a different mask style, like nasal pillows, which have less contact with the bridge of the nose. There are also specific eye masks designed to be worn with CPAP machines that create a gentle seal over the eyes to protect them from air leaks. It's a small addition to your gear that can save you from chronic dry eye. Let's transition to something many of us do without a second thought: taking a nighttime medication to help us sleep or to help with allergies, whether it's an over-the-counter PM pain reliever, an antihistamine, or prescription sleep aid. Many of these drugs have anticholinergic properties. That is a big word, but here is what it means for you. It blocks the chemical messenger, acetylcholine, which is responsible for involuntary muscle movements and bodily secretions, including tears and saliva. A systematic review in the Journal of Internal Medicine has flagged anticholinergic drugs as a major contributor to dry eye and dry mouth in the elderly. When you take that antihistamine to stop a runny nose, it dries up all mucous membranes, including the eyes. You might sleep through the night, but your eyes are essentially in a drought for 8 hours. Imagine trying to slide down a water slide after someone turned the water off. That is your eyelid trying to blink over your cornea after an antihistamine. Now, I am not a doctor prescribing your meds, and you should never stop a prescription without consulting your physician. However, it is worth a conversation. Ask your doctor, could any of my evening medications be contributing to my dry eyes? Sometimes simply switching to a different type of allergy medication that is less drying or changing the timing of the dose can make a world of difference. Knowledge is power, and knowing the side effects allows you to mitigate them, perhaps by using a thicker gel eye drop right before bed to counteract the medication's drying effect. This leads us perfectly into our next point: the evening eye routine. Most of us have a routine for our teeth. We brush and floss religiously. But do you have a routine for your eyelids? As we age, the oil glands in our eyelids, called the Meibomian glands, often get sluggish. The oil they produce becomes thick, like toothpaste, instead of flowing like olive oil. This is often the root cause of that morning blurriness. It's not that you aren't making tears, it's that the tears are evaporating because they lack the oil seal. Getty Images, we can jumpstart these glands with a warm compress. A study in the journal Optometry and Vision Science showed that applying a warm compress to the eyelids for just 5 to 10 minutes significantly increases the thickness of the lipid layer of the tear film. Think of it like melting butter. By applying gentle, moist warmth before you sleep, you liquefy the oils in your eyelids. Here is the actionable ritual. Get a dedicated eye mask that can be heated in the microwave. They contain beads that hold heat. Warm it up, test it on your wrist to make sure it's not too hot, and lay it over your closed eyes for 10 minutes while you listen to that audiobook we mentioned earlier. After 10 minutes, gently massage your eyelids. This expresses the fresh oil coating your eyes in a protective layer right before you drift off. It feels like a spa treatment, but it is actually a crucial medical therapy for aging eyes. Let's address one final healthy habit that might be tricky, the complete blackout. We are often told to sleep in total darkness to boost melatonin. And generally, this is true. However, for seniors, waking up in a pitch black room can be disorienting and dangerous for falls. But from a vision perspective, if you wake up and immediately turn on a bright bathroom light, the sudden change in contrast can be dazzling and painful, a phenomenon known as disability glare. As we age, our pupils react slower to light changes. Going from 0 to 100 in brightness strains the eye. While not permanently damaging, it causes temporary visual stress and disorientation. The solution is red light. Install a red light, night light in your hallway and bathroom. Why red? Research, including studies cited by the Lighting Research Center, shows that red light has the least impact on your circadian rhythm and melatonin production. It allows you to navigate safely and let your eyes adjust without the shock of bright white or blue light. It's a way to respect your biology while keeping you safe. We have covered a lot of ground today. We've looked at the wind tunnels created by our fans, the pressure of our pillows, the microscopic ecosystems in our bedding, the drying effects of our screens and medications, and the importance of warming up those oil glands. It might feel overwhelming to hear that so many things could be affecting your eyes, but I want you to look at this differently. This is not a list of things you are doing wrong. It is a menu of opportunities. It is a toolkit of solutions that are entirely within your control. You don't have to change everything tonight. Pick one thing. Maybe tonight, you just turn the fan away. Maybe next week, you buy that pillow protector. Small hinges swing big doors. A small change in your nightly routine can open the door to years of clearer, more comfortable vision. You have the power to protect your sight. You have the knowledge to advocate for your own comfort. And that is a beautiful thing. Imagine waking up tomorrow, opening your eyes, and feeling refreshed. No grit, no burning, just clear vision, ready to take in the faces of your loved ones, the morning sun, and the beauty of the world around you. That future is possible, and it starts with how you sleep tonight. So I have one final question for you. Which of these hidden culprits are you going to tackle first? Are you going to adjust the fan or perhaps try the warm compress? Let me know in the comments below. I read them, and I'd love to hear your plan. If you found value in this video, please like and subscribe because your health is worth fighting for, and we are here to fight alongside you. Until next time, sleep well, dream big, and keep your eyes on the bright future ahead. Take care, my friends.